We talk a lot about the safety of our armed forces, and it probably brings up images of the battlefield, but are we doing enough to protect them after the gunfire has ended? Figures have shown hundreds of forces personnel diagnosed with mental health conditions, and more seriously, in 2021, more than 250 people in England and Wales died by suicide after leaving the military. Ross Abbott is a British Army veteran who now works to combat these issues as an advisory board member for the suicide charity Ripple.
When we start to look at kind of the challenges of obtaining a mental health diagnosis in the forces, there's quite a few different areas that I feel that kind of can impact it. First of all is the stigma, and I say, thankfully the forces are getting a lot better. So we've got stigma, so, the significant barrier around, mental health within the military, the culture, is about resilience, and that can stop people from seeking help. We've got the kind of fear that some have about the career impact. So persons may worry that seeking a medical diagnosis, it can start to impact their career, promotions, deployments. I think there's also kind of sometimes issues with access to service, and also the trust in the system a little bit, about confidentiality.
You said things are improving now. How does the military of today differ from the military of when you signed up?
I think a very good question. I think the military of today is moving forward as culture is as well. We've got a generation coming through, Gen Z, coming into the workplace, coming into the forces that are thankfully very literal and emotionally literate about their mental health, about their neurodivergent conditions, and so the forces have had to adapt to that. Otherwise, we're going to have serious issues with recruitment. So,
but how do you balance that need to be more open to conversation about mental health, because it still doesn't get away from the fact this is an occupation where you need to be tough?
Yeah, but I would say to that to understand how we individually think can then that actually make us more resilient. And when we become more resilient, then we can deal with more triggers and impacts that impact us. So to have the literacy to say, actually, I'm struggling at this time, and find the right support for that. Exactly the same as if I was serving and I had a physical injury, I went to see the doctor, I got some physio, I got some medication for whatever the condition was, and I would be back to 100% physical fitness. It's exactly the same.
We're looking in particular today about suicide rates amongst UK troops and veterans, and actually if you look at the figures that I've got in front of me, there are a huge number of people who have taken their own lives, who are veterans, who have left the armed forces. Is this the thing that we're struggling to do to help people adapt to life outside of the military?
Yeah, so when you look at some of the statistics that have been released in the paper today, and other ones that are around, there's now more service men and women and veterans that have ended their life by suicide than actually, unfortunately, lost their life given the ultimate sacrifice in Afghanistan. And I think, we really do need to start to empathise and understand those challenges of that transition to civilian life that veterans do.
And of course we're dealing with people, as we talk about the different generations of the armed forces, who lived through that era where you didn't talk about it and you did have to be tough.
Yeah, it's definitely. And I know myself, more than happy to share on my own personal journey. It wasn't till I left the forces that I realised the periods of time within my service where I had severe depression and anxiety disorders.
If there's somebody listening now who did serve a few years ago and really feels the need to address this problem, they think now is the time, I'm struggling with this, I need to speak to somebody, what's the message you would have for them? I
would say to speak about our mental health, we may have been brought up thinking a decline in our mental health is a weakness, but actually to start talking about our mental health is the first sign of strength. There is support out there. Ripple, an amazing organisation that's starting to put technology in when people who are struggling and are possibly messaging or looking at sites for self-harm and suicide. It will give some support there. Support is there. Even at the darkest of our hours, things can get better, and it is always about hope.
Ross Abbott there, British Army veteran.